the liquid or the chemical that was being labeled apparently hasn't gone through the process of being baptized the vaccine by the country or by the authorities responsible by NDA. So it was a chemical of unknown source.
Okay.
That's how it becomes fake. I don't know whether that is helpful, but
yeah, that is very comprehensive. And maybe to add on that, now, how in your opinion, how do you think this chemical could have made its way to these particular health facilities in these particular districts, and not all health facilities?
It is difficult to know. Even the extent to where it has gone may not have been established by now. It's possible that it's not yet established. But this, we have information maybe, which we need the police to take a lead on, that these are actually vaccines that are procured by the government of Uganda. And because they are labeled not for sale, someone is relabeling them from their own unit. So we want police to take a lead in this one, that these are vaccines possibly procured by national medical stores. And because now there is a national vaccination program that is being updated, and it has been on for 3 years now for hepatitis B. And it started from the greater north. And I think now it is in eastern Uganda, it is in Busoga. So the government, through national medical stores, procures hepatitis B vaccines. But they are scaling up the program gradually. They started from what they thought was the worst affected areas. And so they are coming down. And there is information to the effect that these are the vaccines that people have stolen from government stores and actually relabeling. But also NDA has picked samples with the MOH, Ministry of Health, and they want to analyze the content. They haven't yet given us the results, but that is the situation.
And how can the public spheres be allayed? Because now if a reputable organization comes up to give free hepatitis B vaccines, people will actually not flock as they would have done in the past. Yet this hepatitis B vaccine could actually be authentic. But going by the reports that have been circulating, people are very skeptical.
Well, there are several aspects. I think, one, the Ministry of Health delayed to respond to this crisis. But I entirely agree with the Minister when they say that in the public facilities, people should be vaccinated. But all private facilities should be accredited. And everyone who wants to do a camp for vaccination should first get accreditation and approval from Ministry of Health. And then they can proceed with the mass vaccination. There have been some weaknesses within the Ministry of Health, especially as far as hepatitis B is concerned, because the policy is not clear, if at all it is there. And I think that should have been the guiding document. We have information that they only have a draft policy, despite the fact that this problem has been with us for more than 3 years. So they are going to be answering for some of those things. But when we did an extensive engagement with them, we thought we had dealt with this, but unfortunately, it looks like we are not yet there. So there are people who are culpable within the Ministry of Health. I think they take the lead because they should produce the guiding documents. A vaccine is a sensitive issue, which I think should have guidelines on how it should be handled, who imports the vaccine, and the certification, because we have the routine immunization that is offered by government.
Yes.
But this is a supplementary immunization which government is offering at a smaller scale. Maybe now they're improving, but they should come up with the proper guidelines on how to accredit who should be vaccinated, and I think that can help us to limit. Of course, the damage is already done, but after getting the content, to know the content, the actual content, because we have suspicions, if we get the actual content, then we can be able to deal with the people who have received what they are not sure of.
Okay.
But of course, the average Ugandan cannot know whether the camp they went for had the genuine vaccine or not. So that makes it more complicated.
Okay. Yeah. Now, if we go to some of the engagements that we picked from the social media users, Mubiru Moses Mutiaba says no one knows the content of what they call fake, but Honorable Sarah Pend is saying it may not be fake. As you've said that there's need for...
Yes, I think they also have information that the minister's vaccines could have been stolen from within their stores. And that is one. But also they have taken on the process of giving us the chemical content of what is being given.
Okay.
Yes.
And Mubiru Moses Mutiawa says, I thought NDA would first take suspected samples to labs for testing the contents and then inform the public. Am I the one seeing a problem with my former MP, Dr. Viteche?
Well, Dr. Viteche has been in NDA for a very short time. So I think he shouldn't take responsibility for the mess. He's the chairman board. He's not the head of the secretariat at NDA. So the technical people at the secretariat, because the board is not the one that really conducts the day-to-day running of the institution. The technical people at NDA should be capable. About the samples, I think they've taken samples for analysis, so we are waiting to see what comes out.
Honorable, is it correct that these samples have actually been taken to a lab in Geneva?
Well, that's the information we have. We don't have the documentation, but the information is what we have. You know, WHO deals extensively with vaccines, so and it is based in Geneva, so they are helping us to sort out that.
All right. And Paul Tentena is saying, now that there are people who are already vaccinated with fake hepatitis B vaccine, will Parliament back their argument if they take government to court for negligence?
Well, one is it will be difficult. It's difficult for the average Ugandan to know that they got a fake vaccine. But as people are following, we are dealing with the police. We asked them to give us an update of the case of these fake vaccines, and we want to hear who has been dealing with it. But I think every Ugandan is free to go to court, and you don't necessarily need to get the backing of Parliament. Yeah. But the judiciary will be the one to decide based on the evidence that is produced. Okay. Yes.
Now, Niwagaba Bright Hillary is saying hepatitis B chart is good, and good morning to you, doctor. I would like to know where those fake drugs come from. Should we believe that National Medical Stores has fake drugs? And if this fake drug was not got from National Medical Stores, what is the procedure that this nation, what procedure does this nation use to buy medicine? And from where to the extent of now making us start to believe that we can be vaccinated or injected with fake medicine?
Well, if you take it broadly to medicines, there are medicines that are manufactured within the country, and there are medicines that are imported. And if you want to import medicines, you make an application to NDA. And they visit the factory where you are going to import the medicine from, and they see the practices there, they inspect the premises, and also they get the chemical content from what is documented by the manufacturers, and also subsequently do a few tests to confirm the actual content. Of course, within the country we have challenges. We have a lot of porous borders. We have a lot of corruption. And Ugandans, I think we have gone too far. So when there is money, the effects no one will consider. Yeah. So the thieves are there in our society, and their job is to find the loopholes in the system or to think hard to bring in fake medicines. In particular, this vaccine, we haven't confirmed the content, and like I said, it could be the actual potent vaccine. But when it is stolen from, NMS stores or government hospital stores and then brought back to the market. And because government of Uganda drugs have not for sale, then these people were trying to relabel and then to sell.
Okay.
Yes.
Now, Kenneth Kabagambe is saying, do we have a policy and action plan on hepatitis B as a country? And what is the role of the Health Committee in ensuring that there is support towards non-government organizations like the National Organization for People Living with Hepatitis B, who are working so hard to raise awareness about hepatitis B in Uganda?
First and foremost, like I said earlier, the information we have is that despite the challenge that the problem has been around for a while, the Minister of Health only has a draft and a draft policy, and I think this is unacceptable. And we are working on the report to the House, and then the House shall decide on how to handle. There is some element of carelessness. There should be clear and specific guidelines from the Ministry, because that is their mandate. So the draft policy, the draft action plan, by now, I think this is something that can be worked on in a month and completed. But 3 years down the road, there is nothing, means there is a problem, which we need to sort out as Ugandans. And it is going to constitute part of our report to the House.
Okay.
And then I think fellow members of Parliament shall decide on how to go forward. Of course, as you are aware, our role is advisory, and so we shall recommend to the executive what should be done on this one. Yes.
And in that figure,
excuse me, do you mind updating us on probably when you plan to submit the report to us?
We shall submit the report when it is completed. There are so many issues that have come up in the management of NDA, which we want to do comprehensively, so I can't put a time to it today.
okay. And in as much as you've been explaining, Honorable, Paul Tetena comes in with a question that, do you think it will be prudent for Parliament to recommend the sacking and an overhaul of management at NDA because they failed on protecting formalin? Now it's fake hepatitis B vaccines. Tomorrow it might be something else.
Yes, what we are seeing on the market or in the public is a symptom of problems within the people responsible to do these duties. But like I said, it is a much bigger problem, and I think after we have analyzed what information we have got, we shall be able to come up with a conclusion that will satisfy all the stakeholders. Yes.
Just a clarification. So the guidelines, the policy that we do not have is not only for hepatitis B, but
For other
generally
medicines.
other hepatitis.
Other vaccines. I think there is generally a policy for the other vaccination, which is routine and national. Yes, but for hepatitis, the ministry first of all has the communication problems, because as you are aware, all children are vaccinated against hepatitis since 2002. Against, that is routine immunization at 6 weeks, 10 weeks, 14 weeks. Children receive 3 doses of the vaccine, which is part of the policy. But now dealing with adults, there is nothing that is clear who missed that, especially with the advent of the epidemic. But also the communication challenge is that you find that there are thousands of schools now asking for money from parents to vaccinate kids from school. Yet these kids were vaccinated. Anyone less than 15 years was vaccinated. But there is no aggressive campaign by the Minister of Health to come out clear and say that, they have promoted the Thagan. So there is an issue with communication at the ministry. There is an issue with the policy on management of hepatitis in adults. And these are big challenges. Yes.
Yeah, actually, you've addressed concerns of Godfrey Tumshave and Kyle Omuhororo, also are asking about the communication issues. I think one point that we would really need to clarify on, especially for the public who cannot differentiate between vaccines and medicine. What is a vaccine and what is medicine? We have malaria drugs, We have drugs
we
for
can also
hepatitis
have
B.
we can also have malaria vaccine,
Yes.
but specifically for hepatitis B, you know, I won't go into the science, but I want to put it in an ordinary person's understanding. That, for instance, hepatitis B, before you are vaccinated, you are supposed to be tested. And if you are tested and found positive, further tests are done, and then you are given medicines, antiretrovirals for hepatitis B. But then if you are tested and you are negative, you are given a vaccine to prevent you or to protect you from being infected with hepatitis B. And part of the communication also is that people should know that hepatitis B is transmitted through fluids, blood transfusion, contaminated needles, and it's also sexually transmitted. So the people should also know that. But the difference between the vaccine and the medicine, I think, comes out clear there. That if I'm Dr. Bukenya here, I go to a lab, I want to be vaccinated because I've heard that hepatitis is a scary disease. So when I go, I'm tested first. And if I'm tested, then I'm negative. If I'm negative, I can be vaccinated. But if I'm tested and I'm positive, then it means I get the medicines, which is a lifelong treatment. Yes. So I get antiretrovirals as treatment. I think that's the difference. The vaccine prevents you from or protects you from the infection, and then the medicine actually treats the infection. Okay. So the vaccine doesn't treat the hepatitis infection, but prevents the infection. Yeah. I think in simple terms, that would help the person who is asking that.
Now, Honorable, will stern action be taken against these 5 clinics that were identified for administering fake hepatitis B drugs? Because Ugandans face a serious risk if the culprits aren't punished in accordance with the available laws. That means others can take advantage of such a situation. Well,
I think the first thing, as if you are following the discussion with the police and NDA, is that the NDA Act, the National Drug Authority Act, puts lighter sentences. And this wasn't envisaged in the process. So I think we need to urgently review the law and maybe baptize people who import fake vaccines as terrorists, and they are handled in the terrorism law, because this is dangerous to the life of Ugandans. So I think we first need to identify these people, and then we name and shame, and then everyone knows. And 2, if we are to use the available law, they can get off the hook without severe punishment. So we need to urgently consider amending the law. But also we need to engage the legal minds that deal with the criminality and the justice law and order sector to see how we can modify the available laws, or we can exploit the available laws to ensure that these people get the punishment they deserve. Okay. Yes.
Well, this one is a bit abstract. Which pharmaceutical industry released those fake vaccines, and what was the major role of UNBS in this picture? Uganda National Bureau of
Well,
Standards.
I think Bureau of Standards and the National Drug Authority.
Honorable, just a minute.
Yes.
You talked of amending the law. Which law are we talking about?
I talked about the NDA Act of 1993. Yes. Listen.
Yes. So, Honorable, you are talking about UNBS.
Yes, I think National Bureau of Standards does similar work to what National Drug Authority does. Yes, whereas Bureau of Standards concentrates on many other issues, but I think NDA is the one directly concerned with these medicines. And I'm sure there are many other medicines on the market that are not genuine. So, and then secondly, we are talking about the vaccine, which is fake, in inverted commas. And it was baptized fake because it was being relabeled. And so we need to first of all, yes, what they were doing, these people, is not a pharmaceutical company. They're Ugandan businessmen who are trying to make a quick buck without looking at the effects. So the biggest challenge is to see how we can prevent this process, and if it is possible, to punish them severely. These people deserve a death sentence, by the way. But though the law is not clear on these ones, these particular crimes, but I think if we find the criminal legal minds to guide us, we can get somewhere.
Okay.
Yes.
Honorable, two case scenarios. If the tests are done on this, on the contents of what was administered as a vaccine to the people, and results indicate that it was an actual hepatitis B vaccine, but was relabeled for sale and is not supposed to be for sale, what would be done vis-a-vis if the tests indicate that these were fake drugs and not hepatitis B drugs, but were relabeled?
The person who is relabeling should be punished severely for putting something unauthorized on the market. Whichever way it is, whether it is the real vaccine, whether it is the fake vaccine, because the next person to do it may use the fake one. Secondly, I think we also need to audit our systems in which the procurement, from procurement to delivery to the end user, if at all the drug was stolen from government, now we need to know from where it was taken from, and then stand action taken against those people who are abusing their offices. The ideal thing should be that government should be the one handling hepatitis B vaccination. But what government is doing is they are doing vaccination of all children from 2002. And for adults, for the last 3 years, an amount of money is put in the budget for procurement of vaccines. But because it was a big problem, the commercial businessmen identified a loophole for making money, and that's where we get problems. What I think Minister of Health should have done before is to, first of all, to accredit the people who vaccinate and make sure they are well known. And this is not to deny anyone the opportunity, but whoever wants to do the business should first get accreditation.
Yes.
Yeah, not to only accredit the people who import the vaccines, but also to accredit the people who vaccinate. And then such that you know that even the person who is vaccinating, if you give them a certificate to vaccinate and you catch them using the fake vaccine, they are culpable.
Yes.
They are not innocent because they are procured it from somewhere. No, they are culpable because when they are getting a certificate, they have to clearly show the line of procurement of their vaccine. So I think that should have sorted.
So for now, if I missed it
Yes.
earlier. So if now I really want to get vaccinated against hepatitis B, am I safe then? Where can I go?
Well, I think Minister of Health came out clearly. It said that all public facilities, you go to Chirudu, you'll be vaccinated. You go to Mulago, you'll be vaccinated. So all public health facilities, I think, were mentioned. But also they mentioned some private facilities that have gone to the ministry and gone through the process. And I think, I don't remember, but it is in the press statement of the ministry. I think there was IHK, there was Nakasero, there was Mengo Hospital. There were several that the minister listed that had gone and got permission and showed where they get their vaccines from. So, and I think that is fair guidance as a way forward for now as we wait for the results of what came out. But that doesn't mean that if you have your clinic, it stops you from going to the ministry to do an application, and then they go through the processes, and then they also accredit you. Okay. Yes.
From a layman's understanding,
yes,
is it really safe for those people who got that vaccine, fake vaccine?
Should they
Are
worry?
they safe, as the minister said?
I think maybe she has information to show that that she hasn't disclosed. So, but I think who got the fake vaccine? That's the first question.
And then someone is asking actually,
Who got the fake vaccine? It is possible that these guys hadn't yet distributed. So who got the fake vaccine? That's what we need to establish before. Well, we think they will come with the results this coming week. Yes, so we are sure we shall be getting something. And the minister shall make a statement even on the floor of the House to explain, yes. I think people should continue with immunization using the guidelines that the ministry gave, because that is where we are sure the safe vaccines are. And we still know that hepatitis B is still there. But also the most important thing is to understand how it is transmitted. And so we put emphasis on prevention. We put emphasis on prevention. It can be transmitted mother to child, so it is important for every mother to be tested when they are pregnant. 2, and then they be able to protect the child because the mechanisms are there. It is also important to know that it is sexually transmitted, so protected sex, if you can't abstain, is also very important. And then 3, contaminated injections, syringes, that is another option. And then the blood transfusion, I think there we have mechanisms of sorting that out now. So people should know how it is acquired, and people should know how it can be prevented, because prevention is much better than all the options we are talking about. And I think that should be the first line. 2 is that Minister of Health should come out clearly and pronounce themselves on 1, the vaccination that is being offered, 1, to children less than 15 years, and when less than 15 years and was fully vaccinated using routine immunization is protected, and unless if they are born with the virus. Then people from northern Uganda, and currently now the program is running in Busoga, and I think next year it may share some areas of western and central. So those who are not in position to pay for the vaccines, those programs are still there. So and people should engage and involve themselves in this. But as I said, the primary issue is prevention. Then lastly, about people who have received the vaccine, well, it is possible to follow up and see where you got it from, but the centers that were holding the unauthorized vaccine have been publicized. So if you are there, then you have to sort out yourself and go and see if that is the case. But 2, it is also important, now that it has happened, that we be patient and we wait for our fate when the actual chemical content of what was used comes out. Yes, that is there.
Thank you very much.